Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And today I am here with Brian Griner, MD, Internal Medicine and Pediatrics, also the owner, Griner Medical Group, but more importantly, the godfather of primary care in Valdosta, Georgia, I would say. So, Dr. Griner, what brings you in today?
Well, I'm here to talk about a mixture of things, both high and low and in between.
All right. You've been here for a while. You're well known throughout our community, have served thousands and thousands of patients. I think everybody has been seen by Dr. Griner.
I've had contact with quite a few people.
Yes.
I've been here for 25 years. Started in 99 and straight out of residency, and I've enjoyed every second that I've been here. That's the summation of everything. I've made a lot of good friends over the years, a lot of patients who are family members. We were just talking with one of your cohorts today about her grandmother, and today would have been her birthday, and she was a beloved patient. Not just well-liked, but she was beloved, and she was always a bundle of energy. It is connections like that that make it easy to be a primary care doctor.
What made you decide to become a doctor? Tell us about where that passion started.
Well, I was born up in Berrien County Hospital.
I didn't know you were a Berrien County native.
Yes, I am.
Okay.
So that's a kind of a common connection we have there, Miss Erica.
Yep.
And I was born there. My mother worked in the hospital initially, and then she went to go work with one of the local doctors. But my afternoons were spent in a hospital room doing my homework. And so I knew everyone there. I knew the people who worked in the cafeteria. I knew the people who did the janitor work. I knew all the nurses. I knew most of the doctors. And so it just kind of became almost a rite of passage that I would most likely become a doctor. And I followed through on that. At the time, I knew I was probably going to become a primary care physician. I was thinking more family practice until I got into med school, and then I kind of steered in this different direction than I'm in now, which is essentially like family practice, just a little more detailed. And I've never looked back. It's been a good roller coaster ride.
Well, what I heard from that is that I need to bring my children to work more often.
Yes.
So that they can
that being said, there have been times that I've carried both my son and my daughter up here to the hospital with me. Mm-hmm. My oldest is going to be going into speech therapy, so quasi-medical, but my other two are looking at going to medicine as well, too. One of them even told me that he wants to come back and replace me.
Oh,
nice. But not necessarily in a good way. I think he wants to just kind of take over, but do something different. So, but that being said, I think that type of fostering or mentoring, even at an early age, is key for everything there. It becomes more of a relationship, a different type of relationship I have with my kids on a different sort of common ground. But it's the same sort of thing we kind of do with our patients as well. We try to get that common ground, so not only to let them not just necessarily trust us more, but to understand what we're trying to get them to do, to get them believing that they can make a difference in their life. And once they get to that point, then everything comes a little bit easier.
Yeah. So a lot of people don't have primary care providers here in our area. When we did a survey not too long ago, and it was like 70%. And I think a lot of it's probably the younger, like 18 to, they just hadn't felt the need for it yet.
Right.
They're that kind of that in between. But what is your advice to people to try to get them to take their health kind of seriously and make sure that they're getting checkups regularly, and what the importance of it? Like, how do you explain that to people?
I think a good thing about that is that as they're coming along in school, you have an opportunity as a pediatrician to try and make some positive influence on them. And one of the things I try and impart on a lot of these kids and all there, they may not know what they're ultimately going to be, but they need to have a vision of where they want to be at. And part of that vision is that I want to go from point A to point D at some point. And how do I need to get there? Well, it's not laying around on your phone all day long. It's not vaping and smoking and doing other things that you know that are not going to be beneficial to you, both physically, mentally, and those types of things. Trying to get them to see that part of it early on. Then as you become a young adult, trying to choose some healthier habits as well too. And if you have some sort of genetic predisposition, because that's one thing we can't escape is family history, is that maybe I should seek out a medical professional sooner rather than later. One of the beauties I think I have with my practice is I see both real pediatrics all the way down from birth upwards and all, and they kind of limit that down to pediatricians. Some of our family practice people do that as well too, and they're able to make that intervention as well. Is that these parents say, well, I'm having a call for a cold. Can you help me out? So yeah, we can get you worked in and kind of get you taken care of, and that opens the door. For instance, I've had a sub-segment of our community come in for one family member had diabetes. Well, then they wanted me to see another family member and another family member. And these people are in their 40s and 50s. And that's now turned into about 100 family members who had no preventative care done whatsoever because of a language barrier. And so as a result, we're making some headway there.
Yeah.
Trying to keep them healthy now because these people, they work from sun up to sundown 7 days a week. So to convince them to come in and take some time off is a big ordeal, but then you can say, look, I'm getting these other problems taken care of so you can work longer if you wanted to, or go spend more time with your family.
Well, I imagine people don't know, like their normal or their healthy is different. Like they think that is life as like, does that make sense? If you're living with, let's just say, pain, and you start to that becomes your daily life, and you don't even know a life without that pain. Or you think
it's not serious enough to see a doctor. You don't, you don't want to bother a physician with this, what you think is something small.
Or even along those other lines or two. So you have another subsegment. We have, gyms all over the place. People are working out more and all there, and they think, well, I'm working out, I'm going to be healthy. Well, there may be some other things that are coming up because of that, like the chronic pain issue. Like, pain in a certain area may be a sign of something simple, but it could be a sign of something more severe or serious. It could be the reason why you can't run on that treadmill as long is because, you're going to be the oldest living member in your family and you're only 40 because everyone else died of heart disease. That's a normal history we get here in South Georgia.
Yeah.
It's estimated by 2050, I think a recent our recent story came out this week, 61% of people have cardiovascular disease.
Yeah, and it's probably higher here in our area.
Exactly. In the southeastern United States, we live in a cardiovascular belt, a hypertension belt, an asthma belt, a migraine belt. Whatever bad belt there is, we live in that belt. So there's lots of pathology there.
And I would ask, what is common things that you see or what's prevalent to our area, but I have a feeling I'm going to get the answer that Dr. Connell had about what he sees in the ER, and it's probably just all over the place, anything and everything you see. But is there anything?
In my case, I see anything and everything, and then fortunately, we've also started carrying a reputation. We take care of a lot of the weird and esoteric things as well, too. We get those diseases that they're like 1 in 100,000, whether it's genetic diseases or other unusual occurrences. We have a lot of that in our clinic. The mantra in our clinic is, if it looks like a zebra, start looking for the albino zebra because it's probably out there for us.
Yeah. Well, I know I texted you a photo one time of my son's head. He was losing his hair because I think he had a ringworm. And remember that, and it was because he plays football and stuff and wore helmets and what have you. I promise he does take showers. But he had started losing his hair, and you had to put him on that medication that he had to take for 30 days because it would not go away. It was bizarre. So I bet you get...
We'll get a lot of stuff.
So when do you sleep is my question, because I can never figure that out, because I see you here morning, night, middle of the day, and then you're also over at your clinic too. So
Between
we need
2
to
and
know.
4 a.m.
Okay. Is that healthy to get 2 hours of sleep?
No, it's not. But that's why I'm able to plug myself into the wall and, recharge. So.
Okay. But
My day typically does begin about 4:30 every day. So I get up, start reviewing records and all for the coming day. And
what time do you go to bed? For real?
If I can, 10 o'clock.
Okay.
So.
All right. Well, you're one of the few physicians that still sees patients in the hospital,
Yes.
right? So that's why I said I see you here like morning, night, during the day, because you also serve on our board. But I mean, that's a lot.
It's a lot.
But yeah, how do you do it?
But too much is given, much is required.
That's right.
So that's why I review it as. Well, I've always viewed it as. So, if I've been given the ability to take care of people, then I take care of people. Oh, I'm not going to waste the talent. So.
Yeah. Well, that is so sweet. I know one time my other son, you've cared for all my children, but he had some kind of rare something where he was a baby, and I don't even know that we ever figured out what exactly happened to him. But I remember that I took him to your walk-in clinic, because of course, as a healthcare professional, we don't ever use the ER, right? We're like, we could be dead on the side of the road. We're like, no, we're not. It just doesn't require an ER. But anyways, I had taken him to your walk-in clinic, and they were like, you need to go to the hospital. And I will never forget when I came in and I was going up the elevator to pediatrics. You were walking in and you met me on the elevator and just like started listening to him and figuring it out. I mean, he was only like 6 months old or something, but that certainly made an impact to me. And that's when I was like, this doctor has got going on, because he knows what he's doing. But then being able to see how you serve on our board of directors and just the different leadership roles that you also serve on here at the hospital. Tell us a little bit about what you see, like your view of our health system.
Well, it is a process that's in evolution, adaptation, whatever term you want to put in there. We've come a long way from where I started 25 years ago. When I started, we did not have a cardiovascular program. And a lot of our other programs were very fledgling and just not that mature. And we've grown well beyond that. I would say we are as a term that Mr. Dean likes to use, is a destination for healthcare. We're a major driving force in that. We have people here who are trained on an incredible level in all areas of our medical staff, not just in the subspecialty world, but in some of our primary care people as well too. And I think seeing that evolution of the medical staff has been a great thing. Seeing the fact we're able to keep more of our babies and all here, thanks to our neonatologist. Seeing that we're able to do more of our heart procedures, whether it be TAVR, whether it be the high complex PCIs, whether it be bypass valve surgery, the vascular procedures that we do, the electrophysiology that we do, even a lot of the high risk OB that we do here too, in addition to taking care of the bread and butter that we have to deal with every day, the pneumonia, the COPD, the diabetes, the high blood pressure, the cuts, the scrapes, everything in between. And we've just kind of slowly but surely plotted our way forward and kept getting things better.
Yeah, it's really cool from my perspective, just seeing especially how much growth we've seen in the past couple of years. It does make you proud to be in this community and proud to be in this health system at this time. Because it's going to impact. I mean, we are becoming like a regional destination for care and creating something very special for our community and for our families that live here.
I agree totally. And we have our challenges. Every system has their challenges and all. But I think one of the big things that with our challenges, we don't seem to back down from them, and we try and help kind of frame in a way so we can kind of, like I said, keep moving forward, regardless of the challenge that comes up. And, during the COVID time, this community rallied around us, and I think it was a good thing for us in that regard. I mean, we were
I do too. I mean, it was a horrible thing in general, but everybody came together. We had to. Every department, every physician. I mean, everybody was just coming together to see, how we were going to best deal with this.
But the community came together too.
They did.
They were very
absolutely
supportive.
Did.
And that goes a lot there. I mean, if you have the support of your community, you can do a lot. I mean, otherwise we'd be like some other local area hospitals that are floundering and all there and closing down. And I don't see that happening. I don't see us being as vulnerable as what we once were. So,
yeah. There's a lot of hospitals that are shutting down or at risk, especially in Georgia and rural areas, and being able to build a new ER in Berrien County, I think speaks volumes. And then the expansion project that we have here going on.
Exactly. I mean, both these projects are huge. I mean, the expansion up in Berrien will be bigger than the entire hospital I was born in. So that's a great thing. The expansion project we're going to be starting down here to increase the availability of care, not just through the emergency room, but also for our women and our infants and all, is going to be tremendous.
Yeah. I mean, you get to see it all because you see the babies that are born. So when you have a child, you have to know who their pediatrician is going to be. And when you're still in the hospital, before you ever leave, the pediatrician comes by, introduces themselves, sees your child. And then you're also seeing patients that, are at the very end of their life.
Yeah, so how often do you see babies and then see them when they have children? Has that happened to you throughout your career?
I have. It's kind of strange how this occurs. Over time I've had some grandparents that I've taken care of, then I eventually take care of their kids, and then their grandkids, and then sometimes it works backwards that way. But I've got about 15 or 20 that I have seen since birth who have gotten married and then started raising a family of their own.
That must be a cool feeling.
That's a very cool feeling. So, especially when they say, whenever I was a baby, Dr. Griner is my doctor, and it really starts making me feel old. But I like it. I mean, it's a good feeling. I mean, it just gives that warm fuzzy inside.
Yeah, because they're trusting you. They're trusting you with their care, but then they're also trusting you with the care of their child, and I think that speaks volumes. So.
Yeah, I think when we talked to Dr. Bloss, she had a similar thing. Was that because she's been in the community so long as well, has seen the little kids, and then now sees them as adults with their kids.
Exactly.
And I just think that's so cool to watch people grow up like that.
It is. It is a very cool feeling.
What do you see as one of the biggest challenges that our community faces just in general with health? Access to health and/or, is it just lack of education about how to be, or lack of prioritizing it? What do you think?
I think a lot of our constraints are on some level economic. And it's economic beyond what we can deal with, within the health system itself and all there. A lot of people feel disenfranchised because of economic reasons being the main thing there. I don't think it goes much beyond that there. I feel like if they come to the hospital, that they're afraid that they won't be able to be taken care of, or that something bad really is going on. And so there's a little bit of a fear factor in there too, and that there's going to be something we can't fix. I think there's some elements of that there. It is a very multifactorial problem. But I'll go and tell you, it doesn't matter, regardless of their ability to pay. If they show up here, they'll be taken care of.
Yeah. And I think that's an important reminder, too, that we are a not-for-profit health system, and we do treat anybody regardless of their ability to pay. And it's important that we remain, vital or vibrant in this economy and in this area, because if you don't have your not-for-profit health system that can care for you, then where do you go? Where do you go? Who cares for those people?
Exactly. And so, if you look at all these doctor TV shows, they always try and paint that in such a negative connotation. Well, we can't do Ms. Jones's surgery because her insurance won't approve that. If it's something that is a standard of care, then it's a standard of care, and we're going to do that here. That's what we do day in and day out, 365 days out of the year. regardless of which service you're on here in the hospital.
Yeah. I know it could be scary for anybody coming to the hospital. I mean, you have so many different factors that they are considering as they're coming in. Number one, probably being money, like, what is this going to cost me? What are they going to find out's wrong with me? And I think that our healthcare team really tries to do a good job of understanding that patients most of the time don't want to be here. It's scary for them, and then trying to console them and give them the best care that they can to alleviate those concerns. But
I agree.
let's talk about the significance of the Mercer partnership.
That's a good thing.
Yes. So we just announced that we have our residency program. So we've got graduate medical education, and that's for those that don't know anything about medical education. You did not grow up in a hospital and go to be a doctor.
Exactly.
But for those, that is, after you get your medical, graduate from medical school, then you come here, you can do your residency training where you decide, you specialize in whatever you're going to, whatever your field is going to be. So we have our internal medicine residency program, which is what the degree you have.
Yes.
And then we also have transitional year that's starting next year. And then we also have Mercer University School of Medicine 3rd and 4th year clinical site. So we'll have those students come in this summer.
Exactly.
So tell us what it means from a big picture perspective.
Okay. So I've been affiliated with Mercer now for almost 20-something years. I've been one of their professors in their rural health rotation because they've always been a big proponent of that, trying to get people back to some of the more medically underserved communities throughout the state of Georgia. And that's been one of their mantras or edicts. And it's been very beneficial in that regard. Here a few years ago when we started to start up this residency program in a more earnest thing, they help affiliate with us so that we can kind of move forward with that. And that program has taken off. I mean, we're putting out, several new physicians, and we'll be doing that. Our first real graduating class will be the end of this coming year in 2025. And
we already have two from that class that have signed on to stay in our community. And
so see, that's new knowledge to me, but that is great. And that the data would show that we'll probably get one or two more of those other ones to stay in our community as well too, in an area that needs more doctors. Along those same lines, with the transitional year allows us to train some of the other people who are going in some of the other areas like ophthalmology, radiology,
anesthesia.
Anesthesia is another one too. So that they can get some of that baseline internal medicine training before they go on and start dealing with all these other issues. And so I think that's a big boon for us as well too. This opens the door for other residency possibilities. Now, that sounds great and all, but what does that really mean? I think what it means is that we become more of a teaching institution. And we start having that teaching mentality go around, that it makes you raise your own internal bar a little bit more. You just don't do things just to do them. You have to start thinking about, why am I really doing this? How can I impart to someone who doesn't know what I'm doing, why I'm doing what I'm doing? And that helps to educate them. It also makes you, I think, a little bit more conscious of dealing with patients and all there, so that you can explain to them a little bit better, not just go and do. And I think it just, like I said, raises that internal bar for all of us. But it's also a great boon for our community as well too, because these are people with higher paying jobs, bringing in more money to help out with some of the tax base, which can allow us to do things like help the underserved, because that's where a lot of our money comes from in that regard. And so those things are good in that regard. But then you toss in the 3rd and 4th year medical school. Now you're fixing to raise that internal bar even higher, because you really are teaching people, and they're sponges. And every one of them that have been down here so far in this trial run that we've had want to come back. Well, at least the ones who've been in my office. Anyway.
Yeah.
So a lot of them already signed up for 4th year sub AIs, so they can come back and see Valdosta again.
Yeah.
That's a great thing.
Yeah. Well, because there was many years where we hardly had any physicians coming to our community, new to the community, and certainly we've seen a lot more in the past couple of years. We've probably had about 80, I think, come through or move here to serve. But the needs are there. We have the population. We need primary care. We need specialists here. And it's hard to recruit individuals that aren't from here just to cold turkey get them to move to South Georgia in general. Now I think our organization is becoming more attractive to those people.
Right.
It's getting easier. But
some of that might be due to some of the public relations people we have around here too.
maybe, I don't know. But y'all have to act. Y'all have to
Our
perform
award-winning
for us.
podcast,
Yeah.
I think.
That's right. International awards.
That's
Is that
right.
that's right.
International. But yeah, I mean, so having this educational component to our health system not only elevates the care that you're going to receive, but then those people staying in our community and then serving in our community and building our community, and everybody kind of doing that in tandem is just
I think
really
it's
cool.
great because I remember maybe 6 or 7 years ago, I wanted to see a GP, and I wanted specifically to see a female GP. And there was only like one that I could pick from.
Yeah.
And now to look at our, thing we have with all of our physicians, there's so many, and it just makes me so
more
happy
variety.
that, if
have
a
more
woman
choice.
wants to see a woman, she has all these choices of physicians.
Yeah, for sure. I lost my train of thought, so yeah.
Sorry. No, I just was saying that's great because I look at our residency class and there's just so much diversity there. So, if someone wants to see a doctor that looks like them, they have that option with the internal medicine residents.
Yeah, so it also gives variety of choice to our
Exactly.
to our community.
And that's so important,
But I think a lot of this goes back to the fact we just have one huge team working here. All the way from our environmental services people who, make your room pleasant so you can
Right.
feel like you're safe, secure, and clean in there, to our nutrition services people who make sure you have the meals that you need, to our nurses at the bedside giving you the medicines that you need to get you better.
I refer to our hospital as like a mini high school. It's also like a mini city within a city, because you have so many different departments that work together and have to support each other to make it successful, and so many behind the scenes jobs that people have no idea about. I mean, think about.
I don't think people know how much the maintenance people do here.
Yeah.
I mean, people like Rick and his crew come in anytime there's a leak, whether it's Christmas Day, Christmas
Right.
night, they're here.
Yeah, I mean, before I started working here, I didn't know how many jobs were available within a health system. You just don't think about it. I mean, it never occurred to me. Marketing, obviously, and then all these other different
people
areas.
always ask us, like, how do you why do you have to market a hospital? Like, what do you do? And I'm like, well, there is a lot to tell. I say we don't really have to market it. We just have to tell our story, and we have to tell the story of the people that work here, right?
Exactly.
Because they do phenomenal things. So that makes our job easy. But there's so many stories to tell. There's
Exactly.
not a lot
Like
of
today,
things
we're having an
happening.
honor walk occur.
Yeah,
I
absolutely.
mean, that's a huge story in and of itself.
It is. It absolutely. So that, for those that don't know, is when someone is an organ donor, they can choose to be a part of an honor walk where our staff and physicians will line the hallways as the patient's going from their room to the operating room, just kind of in solidarity, and then also out of respect for their decision to donate their organs and essentially save dozens of other lives through their
Exactly.
donation. So that's a very touching event. If you've never been a part of one, it'll get you every time.
Oh, yeah.
So, but we are grateful for those that choose to do that, because that's another important part of the organization, is that organ donation. So,
Definitely.
you want to ask your famous question?
Yeah, well, you said he's here all the time, so I'm assuming he's got to eat while he's here.
That's right.
But we always like to ask our guests at the end, since most of them are physicians and you guys are here all the time, what your favorite meal is at the Spice or the cafeteria.
I guess favorite meal or most common meal, probably the same thing. So whenever I come in here on the weekends and Lee is working the spice.
Lee.
And everybody knows Lee.
Everybody knows Lee.
I don't have to order. He's already got the 2 pieces of toast on the thing. He's making me my bacon, egg, and cheese. And now the other ladies have learned that too, so I don't even have to order. God forbid I ever want to change my order.
I know, but they already have it ready before you get there.
You
would never say anything. You would just be like, thank you.
Well, it's so good. I mean, they fix it just the way I want it. So
yeah. We had Dr. Kirtley mention that too about the Selena and the coffee, the Starbucks. She can also does that with the coffee. She'll get to know your order and have it ready for you before you even make it to her station.
Now, my second favorite thing would have to be some of the muffins from the Spice.
Yeah.
It's good muffins.
They're very addictive.
Well, Kara Hope gets the chicken tenders all the time, and she has had her order pre-made for her as well.
Hers is very easy, though. It's just chicken tenders and French fries.
Curly fries. Specifically.
Curly fries. Okay.
The curly fries are good.
But those are both like breakfast items. So do you ever get anything else that's not breakfast? Like lunch or dinner or anything?
Not really.
Just curious.
I just keep going.
Yeah, he doesn't stop to eat. That's the thing.
Yeah, we already heard you only sleep 2 hours.
Yes. Well, Dr. Griner, we appreciate you and thank you for coming on with us. And just thank you for everything that you've done throughout your career, throughout your time here, to help our organization be successful and help us deliver the best care to our patients.
My pleasure.
So, all right. Well, thank everybody else for tuning in. And if you have any questions, comments, you can always share those with us. We'd love to have certain guests on that you are interested in hearing from. And we just thank you for your support.
Yes. Thank you, everyone.
Thank you very much.